Well, unfortunately, you get to hear me again. And so we'll look at California a little bit more in depth this time. And California is sort of an interesting case example because there's no one California. There's a lot of Californias, and that's even true in wastewater and environmental management. And so we'll use a couple of case studies of policy implementation and current policy developments that are akin to the EU directive to see how that plays out in a diverse place like California. So all the challenges I talked about at the federal level, we've got them all in California as well, for sure. So in the wastewater sector, challenges in California include water quality, affordability, and access. And those are two different things, but related. So access is do you have access to adequate sanitation services? And then affordability is, can you afford them? So you may have access to adequate sanitation services, but the affordability is a challenge, or a challenge for some groups in a community, but not others. Also dealing with climate change. There's been a number of different initiatives in California that have touched on aspects of wastewater treatment in our climate change policy in the state. Water conservation and overall long-term water use efficiency has been a big topic of a lot of discussion. And then finally, resource recovery. So we'll especially talk about affordability and access, conservation, climate change, and a little bit of resource recovery here. The wastewater sector in California is big. We have about 1,100 collection systems, about 1,000 different treatment facilities, anywhere from very small ones that might be treating just some industrial wastewater, up to the Los Angeles Department of Water and Power and LA County that have two of the largest wastewater treatment plants in the world, about 10 miles apart from each other. There's a big mix of the level of treatment that is used. You'll have secondary, tertiary, and advanced treatment. So secondary and then clarifying, and then tertiary being removing nutrients, and then advanced water treatment, we generally use that as the bucket of treatment that would do disinfection and for possible reuse, which could come from direct, indirect, potable reuse. There's also 1.2 million on-site private wastewater systems. These are generally septic tanks, but not always. We don't always call them septic tanks because they could be in a small school, a lagoon, or something like that. So we'll use a general term of on-site wastewater treatment systems, but a large number of them would be septic tanks in private lands. The effluent is from wastewater treatment goes to a mix of land and water bodies, and those are permitted slightly differently under MPDS permits. And overall, I've not found a good number on what the wastewater industry, the total amount is, but through some projects, we've done some calculations with per capita spending, and it's easily more than a $9 billion industry in the state. So it's pretty significant. You can see on the right, oh yeah, we have a laser. You can see on the right here, these areas are the regional water quality control boards in the state. So each of these shaded regions is essentially a regional entity where regulations take place around drinking water and wastewater. And so those permits that I mentioned, that all the different facilities will have, they will be negotiating those permits with these regional water quality control boards, and the regional water boards then coordinate with the state water quality control board in what is not always necessarily a simple relationship. It's not a delegatory relationship. And so you have these regional entities with some amount of autonomy in developing permits. And so you might have different water quality outcomes, stringency, the level of stringency in Los Angeles versus Humboldt County, which is absolutely what happens. So another way the diversity of the state sort of takes shape. So starting to talk a little bit about affordability and access. California's been on a long-term effort, influenced highly by the Millennium Development Goals and Sustainable Development Goals at the international level, for ensuring access to water and sanitation in California. So we had a bill in 2012, Assembly Bill 685, that identified what we codify as the human right to water, safe and affordable drinking water, And in addition, that assembly bill noted water for adequate consumption, cooking, and sanitary purposes. So this human right for sanitation was codified in developing a human right to drinking water. We've had a whole series of assessments, what we call the drinking water needs assessments. These have identified some pretty big price tags on the funding gap for ensuring safe drinking water for all. The most recent one, which is in 2024, identified about $12 billion in funding needs over the next 5 years, which would largely come from those state revolving funds. We provide technical assistance to qualifying communities. Lower income, underserved communities can get low and no interest loans. But importantly, a couple of years ago, we started realizing that the access to water only does so much. You also need access to sanitation. So in 2023, the State Water Resources Control Board passed a resolution to identify the human right to sanitation for water-related services and started what we're calling what is called the California Wastewater Needs Assessment. So through this series of resolutions, again, we're talking about almost a decade of policy resolutions at the state level, codified California's commitment to ensuring that all Californians, residents, no matter where you live, have access to water and sanitation services. And the most recent resolution was in 2022, and this identified this policy goal and also identified that we need to figure out how much money this is actually going to cost, because California has a habit of coming up with very big goals with very big price tags as well. So that was the origin of the Wastewater Needs Assessment. This is a current project led by colleagues at UCLA, also involving ourselves at the California Institute for Water Resources, colleagues at Sacramento State and University of Massachusetts. And the overarching goal is to develop a framework including compilation of existing data to help address sanitation deficiencies that inhibit the water board, state water boards, vision of clean, safe, and affordable water for human uses and environmental resource protection across California. So this was originated in AB 685, but the idea is that over the next decade, we will quantify the gaps and identify new funding sources similar to the way California has over the past decade for drinking water. So with these risk assessments in the water agencies, the approach that we've taken do come up with criteria to evaluate risk of failure or inadequacy, come up with a cost of what it would be to improve that for communities that can afford it, that meet income guidelines at the state level, end up ensuring that they comply with requirements through policy and regulations, but for communities who can't, identify how to find new funding sources for them. And then the third part of this is an affordability assessment as well. So you can think about affordability for the state or for localities, but then also for individual households. So this kind of tiered approach to affordability is embedded in the assessment. So I'll talk about just quickly about our part of this overall work. We're sort of a smaller portion of the overall project. We've run a baseline survey of community needs. These would be communities that don't fall within the generally won't fall within the regulatory frameworks of the Clean Water Act and implementation. So essentially communities that are kind of off the grid of wastewater, which are really important. So we implemented a survey. We identified it was an expert survey, and we wanted to identify, what we wanted to learn was trying to obtain quantitative and qualitative data from experts about water-related sanitation challenges. And this would inform the wastewater needs assessment and the policies that come thereafter. We identified that this would be an expert and community-based survey. So there are 166 total organizations. We got a response rate of about 67%, which I think is about amazing in today's current day and age. But a lot of that had to do with targeting folks we knew would have interest. And they were spread across our academic colleagues, advocacy, NGOs, government, although we're working closely with government agencies throughout the entire project, as well as the private sector and technical assistance providers. One of the things we asked was definitions that would translate through the project in some fashion. And we rooted these in principles of environmental justice and literature at the international level, as well as the nationwide level, definitions for sanitation and sanitation equity. So sanitation was initially defined and then revised based on input to be access to safe, functional, and affordable and dignified collection and disposal of wastewater from human uses, including adequate sanitation systems, practices, and wastewater treatment to protect public health and the environment. Sanitation equity then is achieved when social, geographic, economic, cultural, and demographic attributes do not predict your access to sanitation. And this is a specific definition because we've had long challenges in both literature and policy of implementation of equity and equality at the federal and state levels. And so identifying this gives it a quantifiable outcome for sanitation equity. So just some survey results, some highlights. So of the communities that respondents knew, which would generally be a fairly small percentage, but important communities that are off the grid, they have long-lasting issues. They span housing types, but especially single-family residences and multifamily residences, but also recreational vehicles that might be serving unhoused populations as well. And sociodemographic factors, that what we saw at the federal level is absolutely being reflected in some of the survey data, that they're largely impacting Latino mixed communities and also underserved communities, lower income communities. Some of the common issues were identified by respondents as septic systems and septic systems on private wells that aren't, or private properties that aren't necessarily maintained. But in addition to, because of California's economy, we have a lot of transients in the workforce because they'll be moving for either seasonal work, agriculture, and so mobile toilets are a solution for many during work time hours. But what was interesting too in the survey is that at least a third of the respondents indicated the communities they knew of were relying on this for both work and at home for mobile toilets. And then a fairly small percentage identified that a home didn't have access to indoor sanitation plumbing in any way, shape, or form. So next, for our part of the work, there's a larger project going on to identify all these goals, but we're going to be doing some field work, working out across our UC-A&R networks in the counties and the called research extension centers, as well as following up on leads that we've had from the advisory group for the project and others as well. So trying to bring stories to the data so it doesn't end up becoming another policy report with a really big number, but there's actually people behind this. So I'll talk really briefly about water conservation and climate change, and then we'll wrap up. One of the effects of climate change in California and our proactive actions to address it has been to reduce water demand, because droughts have impacted water operations significantly in both cities and farms. Our cities have made a lot of investments over the years, but it's not a new issue. You can see some old-looking documents here from the 1976-77 drought that note the challenges that wastewater treatment plants were facing, because when you have a drought, water conservation institutes a reduction in influent, and then all of a sudden your treatment plant is operating outside of its parameters. And this has been a consistent story throughout the past 2 decades or 3 decades of significant drought, but especially was acute in 1976 and 77 and came to bear again in recent droughts in 2011 and 2016. And we had a large project with the state of California looking at what the cost of this would end up being. And you get into it and there's no one root cause here. And what's important to recognize is that wastewater treatment plants are built and then they sit or they last, right? And if they're not invested in, then they're built based on aged designs. And collection systems are even more than that because they're in the ground and they're really hard to dig up. and expensive to dig up. So we have these eras of wastewater treatment building in California, and if you were building a plant, before 1980, your flow rate, design rate was 100 to gallons per capita per day. And if you fast forward and you haven't done any upgrades to that treatment plant because of enough funding constraints, you're having significant issues right now when our indoor per capita use is more like 50 gallons per capita per day. And then as we've gone along, we do increase the standards, and also water quality requirements also increase at the same time, so you have a compounding problem. And when you design a treatment plant, you're oftentimes looking at text or literature that might be 5 or 10 years old, based on a design guidebook or something like that. So we've always been playing catch up, and we see a whole host of reported outcomes of sediment deposits, odors and corrosion, root intrusion in collection systems, as well as corrosion, higher levels of loading, less scouring, and lower treatment efficiency in the treatment plants. So there's a reference down here. We did surveys as part of the project to sort of have folks characterize what the different issues they were seeing are. A lot of minor issues from water conservation and reduced efficiency across all sorts of different potential problems for a treatment plant. But in some areas, there were major issues. So for instance, the difficulty meeting discharge permit requirements and challenges in nutrient removal were two of the large ones that were having significant challenges. So we did this also for the wastewater reuse sector and also the collection system sector. We rolled it all up and we put it together as part of the analysis of what the impacts would be on water collection, water treatment systems, and wastewater and water reuse systems. And what's important to understand is that this is a whole linked system. And so a wastewater treatment plant operates here, but it's receiving water that could be coming from hundreds of miles away. So one of my colleagues will say, if you're in Sacramento, flush twice because it's a long way to Los Angeles, because we do move water to some extent that far in very small amounts, relatively speaking. And a lot of our water reuse operations here are along the coasts in the populous zones. But these are also places that receive water coming from throughout the system. So they are recipients of all of the flows and constituents that come along with it. So I'm going to stop here a little bit early. You've heard me, before the slides are done, you've heard me talk plenty already, so not a problem. But we have some resources at the end. There's a few links related to water reuse in California, some biosolids policy from the California Association of Sanitation Agencies. And yeah, this is the situation we're dealing with in the state.